In this video, I'll show you why prostate cancer is probably caused, at least in part, by an infection of the prostate gland. Prostate cancer is the second most commonly diagnosed cancer in men worldwide and the fifth leading cause of cancer death in men. But as common as it is, we still do not know what the exact cause of prostate cancer is. Prostate cancer usually affects men aged 65 and older, but in very rare cases, it can affect men in their 30s and 40s. For yet to be uncovered reasons, the incidence of prostate cancer is higher in men living in the West than in Asian men, and it is higher in African American men than in whites. Whereas the African men who live in Africa have a prostate cancer rate that is 40 times lower than that found in African American men. And within one generation, Asian men who move to the West develop a prostate cancer rate that is 16 times higher than the rate of those who live in Asia. This suggests that there are environmental as well as lifestyle factors that are influencing the rate of prostate cancer of men in the West. Established risk factors for prostate cancer include age, family history, and race. But there are other factors that are associated with a high risk for prostate cancer, such as eating diets that are high in animal fats, or diets that are high in red meats, and diets high in dairy products. Diets low in fruit and vegetables, as well as a lack of exercise, have also been shown to increase the risk of developing prostate cancer. Certain genetic mutations, such as the BRCA1 and the BRCA2, can also increase the risk of men of developing prostate cancer. But if we know the risk factors for prostate cancer, why is it that we still cannot prevent prostate cancer from occurring? And this is where the infection theory of prostate cancer comes in. In 1863, Rudolf Virchow was the first to identify large numbers of inflammatory cells in biopsy specimens taken from cancer patients, thereby establishing a relationship between inflammation and cancer. By the 1950s, scientists had learned that a large percentage of prostate biopsy specimens contained large numbers of inflammatory cells. Since then, histologic studies have shown the presence of inflammation near to precancerous lesions in prostate biopsies taken from men with chronic prostatitis. A meta-analysis of 11 studies performed from 1971 to 1996 provided statistical evidence that chronic prostatitis was a significant risk factor for prostate cancer. In support of this argument, it was found that anti-inflammatory drugs such as aspirin or NSAIDs reduced the risk of prostate cancer by 15 to 20% in one study. So what causes inflammation in the prostate? In most cases, doctors do not know what is causing inflammation in the prostate gland. The list of factors that can cause inflammation of the prostate include infection, urine reflux into the more proximal parts of the urinary tract that can lead to chemical as well as physical trauma to the prostate, certain dietary factors, as well as estrogens or a combination of all of those factors. Bacterial and other infections can cause inflammation of the prostate gland and lead to PIA, or proliferative inflammatory atrophy, a type of shrinkage of tissue in the gland, which can then progress to PIN, prostatic intraepithelial neoplasia, which is a precancerous lesion. Chronic inflammation in the gland can also damage cellular DNA, leading to mutations. More specifically, the TMPRSS2 ERG fusion mutation, which is found in up to 50% of prostate cancers. Other evidence supporting an infection theory for prostate cancer is the fact that prostate cancer usually presents in a multifocal manner, and bacteria and viruses infect the prostate gland in a multifocal manner as well. Bacteria and protozoa can infect the prostate gland without causing symptoms, and these infections can simmer in the gland for years. Inflammatory cells at the sites of inflammation can produce inflammatory cytokines, chemical messengers that can damage the DNA and lead to the formation of cancer cells. Some studies have shown that a history of genitourinary infection is associated with prostate cancer, and sexually transmitted infections with trichomonas and chlamydia can infect the prostate gland and remain undetected for years. A positive blood test for trichomonas has been associated with a higher incidence of prostate cancer. Non-sexually transmitted bacteria such as Cutibacter acnes, which normally resides on the skin, and certain strains of E. coli producing a toxin known as colibactin have also been found in the prostate. The colibactin toxin is known to induce the TMPRSS2 fusion mutation discussed earlier. Viruses can also infect the prostate, and herpes simplex 2 virus, as well as human papilloma virus and human herpes virus 8, have all been isolated from prostate tissue. We already know that human papilloma virus can cause cancer of the cervix, cancer of the vulva, and head and neck cancers in women. And in men, it can cause anal cancers as well as oropharyngeal cancers and other types of head and neck cancers. So it is very likely that it can cause prostate cancer as well. And the human papilloma virus has been shown in laboratory settings to transform prostate cells. The HPV vaccine was introduced in 2006 for women and in 2011 for men. It was indicated in both groups for ages 11 to 26, and in some adults who were not adequately vaccinated in their youth. We shall learn the impact of the HPV vaccine on prostate cancer incidence in the near future. It has already caused a decrease in the incidence of precancerous lesions of the cervix in women, and the rates of prostate cancer are already falling, although to date, no studies have been done examining the incidence of prostate cancer in men who have received the HPV vaccine. Recent studies have identified the presence of high-risk HPV viruses in prostate cancer tissue, leading to the speculation that there may be a causal relationship between exposure to HPV virus infection and prostate cancer. More specifically, a recent meta-analysis of cross-sectional studies has shown an association of human papillomavirus type 16 with prostate cancer. Based on all the information we have reviewed in this video, it is clear that we need to ensure the vaccination of all males between the ages of 11 to 26. And we need to treat genitourinary infections and prostatitis aggressively. Most importantly, we need further studies to examine the role of infection in the etiology of prostate cancer. If you found this video useful, like and share the video with your friends and family, leave your comments in the box below, and don't forget to subscribe to the channel. I'll see you in the next video. Thank you for watching.